Welcome to our PM Tampa Bay CEO Spotlight. I'm Ryan Gorman, and with me in studio, Dr. Timothy Bain, CEO of B3 Medical, the official chiropractor and pain management doctor of the Tampa Bay Lightning. You can find them online at b3medical.com. Dr. Bain, thanks so much for joining me.
Yeah, thanks, Ryan. Thanks for having me.
So let's start with the backstory. What led you to the medical field and specifically this part of it?
The medical field. So, yeah, my dad died from the treatment of heart disease years ago, and I decided at that time that I was going to do something different in my life. I was a bad actor in New York City, and in a lot of ways.
You're tired of waiting tables and all that.
Yeah, and so I decided that I was going to try and do something else. I enrolled in chiropractic school, and I really learned a lot of different things that could help people. And then while I was going through chiropractic school, I reffed in the coast and a couple other places. And one of the guys I ref with was working for the Thrashers, and he moved down to Tampa before I did. Started working for the Lightning, and when I moved here, he introduced me to Tommy Mulligan of the Lightning, and that's kind of how I got into the sports side of it.
Before we get into the work you're doing with the Lightning, because I find that fascinating, real quick, how did you pick becoming a chiropractor? I always ask that question to doctors because, you know, you got pediatricians, you've got, there's so many different fields, so many different body parts or things that you could specialize in. Why that one?
So it's kind of weird. I had a neck injury from hockey. I had 3 herniations in my neck. I always had high blood pressure. And after my dad passed away, I didn't know what I wanted to do, but my neck pain got really bad. And I was trying to go to an audition, and my manager said, "You need to go see my chiropractor." And I didn't really want to go to the chiropractor, but I was dragged basically kicking and screaming, and I went to this old guy, and he adjusted me, and I thought I was I thought I was $85 lighter in the pocket.
Wow.
And but my blood pressure went down the next day, and my pain went away. So I went back and I had him explain what he did and why he did it, and I was kind of sold on maybe there's an alternative to some of the things that my dad had done that had actually caused his death. So
the fact that it worked, I mean, that really stood out to you. That made a difference.
Not even for the pain so much as that it was a blood pressure thing. Like it could do something else that maybe my dad could have tried other than some of the meds that they'd given him when he was having his heart problems.
Right. And then how did you mentioned how you got connected with the Lightning, but how did you wind up becoming the official chiropractor and pain management doctor of the Lightning, which seems like a pretty big job based on hockey? Anybody who's watched hockey can realize they probably have a lot they need help with.
I'm really lucky, truthfully. Like I was successful enough working with the guys for a long time, and then I had met another guy through tennis, and we started Saddlebrook Sports Performance up in Saddlebrook, and we started working in off-season sports. So we were doing hockey, baseball, football, that kind of stuff, along with tennis and golf. And a lot of the guys would come back to say when Steve came here, "Hey, we have this guy that we're going to," and they kind of pushed for them to bring me in. And then I sat with Steve and said, "I take care of guys from all over. Please, if I'm going to do it with you guys only, I got to be able to take care of my guys too somehow."
Right.
And he said, "As long as you don't do it on game day, that's fine." And so that's kind of how it started. So 2011, I think, is when I started officially with the Lightning.
And you've been with them ever since.
Yep.
So the recent run of success, that's got to be part you, right?
It's 100% me. It
all lines up. I mean, you can't argue facts.
I mean, it is what it is, right? Like, so, yeah.
Also, the fact they got knocked out early, is that, do you take the blame too? Do hockey players have a greater tolerance for pain? Because everybody seems to think so, and it certainly seems like it based on some of what we see on the ice.
You know, it's interesting. Like I see all kinds of athletes from all sorts of things, and I hate to say this, but women tend to have the highest tolerance for pain.
Okay, well, that makes sense.
And women hockey players have the highest tolerance of any athletes I've ever seen. Hockey players are pretty good, though. Like, for the most part, they're standing in front of pucks that are getting shot at 100 miles an hour, and they get bruises, they get beat up.
Oh, every game.
And they just get back out there and they do it again. And I think it's a culture that's around that, right? I think it's been that way since I was playing. You know, you get out there, you get beat up, you go back, smoke a beer, drink a beer, and go back out. You know.
Is baseball the worst? In baseball, they seem like they get, a finger gets jammed and they're out for they're on the 10-day IL.
I don't know if I want to comment on that. No, baseball. I think that it's a different game. So I think there's less room for error, especially when you're hitting or you're throwing a baseball at 100 miles an hour. And
Right. That's a good point.
So if you're feeling a little off, just a little tweak, plus you're playing 29 out of 30 days, as opposed to hockey, you get a day off every week, and you may play 3 games. So I think there's a little bit of a different mentality there as far as when you can go and when you shouldn't. And I think it's all the same in the playoffs of any sport you're with, right?
Sure.
Like they all go no matter what.
Exactly. Right. We're talking to Dr. Timothy Bain, CEO of B3 Medical, the official chiropractor and pain management doctor of the Tampa Bay Lightning. You can find them online at b3medical.com. You're real focused on reforming healthcare to be less focused on medication and surgeries when people are sick and more focused on optimizing health, keeping people well. It sounds like you want to get ahead of the issues before they become a real serious problem. Talk a little bit about that.
Yeah, I mean, as a chiropractor and working in sports, one of the things that I've noticed in sports is that you work really hard to increase and optimize performance. And I think that needs to be driven into the society as a whole, because as a society, we're getting sicker, we're getting more overweight, we're getting all of this stuff that decreases our function, no matter what our sport is. And I'm a big believer that life is a sport. So even if your sport is Fortnite, you have to be in tip-top shape to be able to do it. Like
binge watching Netflix, it's my sport, and I'm pretty good at it too.
I am too. I can do a lot of that myself. But I think you have to make sure that it's really going to take a paradigm shift, truthfully. Yeah. We've got a really sick older society, and we've got a young society that's going to be heading into that direction. It's easier today to get sick than it was, I think, for my generation, and my generation is sick, and the generation ahead of us is sick. And most people that we see that are in that older age group, they didn't get to this age group of wanting to retire and they're going to just go from doctor's appointment to doctor's appointment. They got there and thought that they were going to play golf and they were going to do all these things.
Enjoy life a bit.
And they don't have that opportunity. So I think what we're trying to do is create a bridge between health care and sick care, which I don't think people really understand even exists.
And what about medications? Because it seemed like we were on this path where there was a pill for everything, and now that's slowly changing to where we're looking to find different ways to get people well, where it's not just based around that. Is that your experience?
I think it's changing slowly. I think that part of the problem has been the changeover to this managed care, insurance-based stuff where primary care companies have to take care of people and they get a pocket of money. They look for less expensive ways to manage patients. So medications became the norm. And they wanted to keep people out of doing a procedure that may get them well faster and doing therapy, which may get them to be able to perform more optimally. So I think we're starting to see a shift as we're starting to recognize that maybe we need to decrease the tendency to use drugs, especially as a first line of defense. And maybe there's other things. So I hope that it's changing. I'm not really sure that there's a financial gain that's going to happen, and I think that's what it's going to take a little bit. They're going to have to look at that a little.
And finally, when it comes to being a chiropractor and dealing with pain management, how has technology along the way, because you've been in this part of the business for a while now, how has that changed how you operate at B3 Medical?
Well, I think that it gives you the opportunity to be able to measure things differently. Like in sports, we tend to measure everything, right? And
sabermetrics.
Yeah. So if you're measuring things, then you can improve on them. And I think that that's really where we're heading more with technology. We can measure things, and then we can compare them at an exponential rate compared to where we could do before. You didn't really have that opportunity. And you can measure them against another population. So you can take your measurements that maybe you have here in Florida and measure them against another group in California and see who's doing better work. And then, in theory, you can go and change your approach faster. So I think that technology is going to drive that eventually. The reality of today's technology is it's actually slowed medicine down, so that I think providers feel like all they do is stand there at the computer, and there's not as much face-to-face contact with their patients, and I think that's too bad.
Final question for you. Can we expect a healthy Lightning team going into the next season? Are you going to make sure of that? Can you give us some guarantees?
Yeah,
You'll do your part at least?
I'm not sure that I want to throw out the guarantees. But, I might. You never know. If it works, maybe if I do, then we'll be looking back at it and go, well, Dr. Bain guaranteed that we were going to win the Cup. So, no, I think we're going to have a really good squad next year. I know that the guys are really excited to get back at it. It stinks to get knocked out early.
Oh, yeah.
But sometimes there's something in it for losing really early and then getting a little bit of rest. And we've got our full team coming back for the most part next year, and it's just going to be a great year again. We're really excited. Excited to go over to Sweden, too. That's going to be really fun.
Well, we know they're in good hands. Dr. Timothy Bain, CEO of B3 Medical, the official chiropractor and pain management doctor of the Tampa Bay Lightning. You can find them online at b3medical.com. Dr. Bain, thank you so much for coming in.
Yeah, thanks, Ryan. It was really fun.